I've just been preparing some of the teaching that I do on the Aleph Masters in Transpersonal Psychology and Consciousness. And the topic that's coming up again and again is that of unusual and unexpected events in mindfulness. So what do we mean by this? Well, when I was doing some research about what people want to know most about mindfulness, one of the topics that comes up is people are worried about, are there side effects or are there unusual side effects from practicing mindfulness? And this is such a great and important topic, and it's one that we wrote extensively about in the BPS guidelines for psychological practitioners who are offering mindfulness, because there's a lot of misunderstandings. The reality is there is a very high incidence of unusual and unexpected events when people start to practice mindfulness. And there's a few reasons for that. I'm going to go into them. I think the first thing to say is because mindfulness in the West is offered as a treatment, there's an expectation that people will feel better when they do mindfulness. And rightfully so. In our Western medical models of sickness and then treatment, we anticipate that the treatment will make us feel better and will make the pain go away. Now, mindfulness actually is a preventative approach. So already there's a bit of a clash of the models there, because if we understand that mindfulness is a preventative approach, then we might begin to recognize that part of what happens when we pause and turn the camera in is that we may encounter some things that are difficult for us, that are challenging for us. We may encounter some patterns and some habits that are in fact creating the conditions for us to suffer mentally and emotionally. And that can be quite confronting. But it's through the process of getting to know those habits and patterns more intimately that we can later on prevent them from taking over and causing even more distress and more reactivity and, more unskillful behavior that gets us into trouble with ourselves and others. So that maybe is the first reason, is people have this expectation that they're going to feel better when they do mindfulness, and then they're a bit shocked that they might be having some different sorts of experiences. There's a number of academic papers, Van Gordon, Van Dam, others, who have explored through quantitative and qualitative methods people's experience of mindfulness. And there's a whole range of symptoms that have been reported by predominantly Westerners and non-Buddhists who have been taught or who are using mindfulness in a secular context. And they range from things which are quite light, so perhaps feeling discomfort or uncomfortable because of increased body awareness, maybe feeling the heartbeat and becoming a bit anxious about feeling the sensations of circulation or heartbeat, changes in temperature, perhaps a little bit of racing heart might be part of that. And it's quite a high percentage of people who have reported something like that, changes in bodily sensations that have provoked a bit of distress. 60, 70, 80% of people may report that. Some of them will find it more distressing than others, but these are symptoms that people were not anticipating when they started the practice. More extreme phenomena can arise, all the way up to feeling existential doubt or existential dread, dissociation, feelings of losing the sense of who I am, out-of-body experiences where we lose that sense of where the edge of the body is. These types of unusual and unexpected effects are a little bit more rare, and they may possibly be more likely to be happening in people who already have certain characteristics and traits that may predispose them to things like dissociation, depersonalization, and derealization. And it also may be dependent on the type and the duration of the practices that they're doing. it's not that likely that people will have those sorts of experiences when they're doing a 3-minute breathing practice. It's more likely if they're doing extended practices of over 1 hour, maybe with mantra or sort of trance induction. Perhaps they might be fasting as well. So you can see there that the conditions in terms of the physiology and the mental practice are building up in a way that could make it more likely that somebody has a sensation of the dissolution or a dissolving of the sense of the body and who they are. One of the things that I found interesting was that those more severe responses to meditation and mindfulness practice occur in about 8% of people, and that's quite similar to the reports of unusual and unexpected events that we find in just a regular psychotherapy. So this raises the question, if this is an intervention, if this is something that can heal, then probably it can also harm. And as a psychologist and a healthcare professional, I'm always interested in doing no harm or minimizing harm, or making sure we know what the side effects are likely to be before we offer the medicine. In the medical language, we use the term adverse events. So when you take medication from the pharmacist, for example, you'll get that big piece of paper that starts quite small, and you fold it out and you end up with a big massive piece of paper that tells you all the possible side effects, which can sometimes be worse than the thing you're trying to treat itself. And in mindfulness, we don't really want to call them adverse events. We refer to them as unusual and unexpected, because people are not expecting them. But anybody who has practiced or taught mindfulness to a significant degree will probably say, well, they are neither unusual or unexpected. And this could be traced back to one of the issues that's arisen as we've taken mindfulness and meditation practices out of the monastery and into the mainstream. In the monastic setting, the way that these practices are taught, it's very clearly defined stages and levels and practices that are exquisitely designed. And at each stage of the practice and the mind evolution, there's a lot of detail about the sorts of things that the mind will do at each stage and each phase. And the teacher will be guiding you, the guru will be guiding your process, and will be able to alert you to certain things that may be likely to happen, and will give you the antidote, the practice that will help you to navigate that hindrance or to navigate that experience. And having brought mindfulness and meditation out of the monastic settings and into the mainstream settings, there's been a bit of an issue there, partly because many of the people teaching mindfulness and meditation are without that level of skill and precision, and I include myself in that. I go to other mentors and practitioners who are much more skilled in knowing how certain practices can activate certain mental patterns in certain kinds of people and what the antidotes are. So there's two things that have happened. One is there may be less awareness and less detail and nuance in understanding some of those side effects of mindfulness, and a lack of experience and understanding. And then the follow-on from that is that people may then react rather than respond. So either the person themselves might start panicking a little bit, and then the panic makes the symptom bigger in the space of the mind, and then it all gets very big very quickly. Or the person who's teaching them is not able to hold what's going on in a way that's responsive rather than reactive. And again, that can sometimes lead to spiraling and disengagement and, oh no, I can't do mindfulness, this was bad for me. Whereas dealt with in a more skillful way, this would actually be considered to be part of the process, part of the learning process, part of what you need to work through or with in order to develop your skills. But you can see that if somebody has been promised mindfulness as a way to reduce stress and chill out and feel calm, that having these kinds of experiences is the exact opposite of what they want. And when they're invited to stay with and work through and be with the discomfort and notice how the mind is reacting around it, they probably don't really want to do that because they want to be calm and chilled out, and they didn't sign up for this. So these are just really a few reflections. I thought I would share them because I'm right in the process of reviewing that literature now. There's some recent research that's come out in 2025, which I'm taking a look at as well. And for those that are serious about using mindfulness and meditation practices for the development of consciousness and awareness, these are things we need to know about. And really the answer to most of these unusual and unexpected effects is pause, hand on heart, take a few breaths, roll your shoulders, ground more into the body, open to the sensation, create space around it. We use going big in my body and mind training method. We use the going big movement there. And stay with it. If it's something that's really persisting, you may want to have a session with somebody who knows what they're talking about, who can give you some guidance. These are often the conversations that I'm having with my students and the teachers that I'm training, is how do we respond to these unusual and unexpected events. But I think that's really the takeaway, is they're not necessarily unusual, and they're certainly not unexpected. And as with all things mindfulness, it's not what happens, it's what you do with it that counts. So go well with your practice, and I hope you found this informative. Thank you.